A few weeks ago, a patient sat in my office completely desperate. "Mr. Dittmann, I'm doing everything right, so why am I still losing teeth?" He ate a healthy diet, got all the important nutrients like omega-3 and vitamin D, and of course brushed his teeth regularly. And yet he had an aggressive gum inflammation that was making his teeth loose. The truth is, there are 3 invisible processes in the body that act like accelerants for inflammation, and these destroy your periodontium even if your dental care and nutrient intake are perfect on paper. My name is Dr. Reinhard Dittmann, and today we're talking about a topic that surprises many of my patients: why teeth can be lost despite a healthy diet and the best care. The answer lies in silent inflammatory processes that often go unnoticed in the body for years and gradually destroy the periodontium. In the next few minutes, you will learn 3 crucial insights that will help you maintain your dental health in the long term. First, why your insulin levels can become a hidden tooth killer, and all without you noticing. Second, why even vegetarians and vegans can have high levels of an animal-based inflammation-promoting omega-6 fatty acid in their bodies. And third, how a frequently undetected intestinal defect can cause all the nutrients you consume to become practically ineffective. And at the end, you'll receive my scientifically based 3-step strategy to stop these silent inflammations and preserve your teeth for a lifetime. Since founding our practice in Potsdam in 2006, we have specialized in the long-term preservation of teeth. And in my now 25 years of working as a dentist, I see patients every day who, despite good oral hygiene and proper nutrient intake, struggle with gum inflammation and tooth loss. However, through our many years of experience and collaboration with specialists from various medical fields, we have been able to identify the true causes which go far beyond the oral cavity. By the way, the third inflammation trap is particularly fascinating, and even many of my colleagues often overlook it. But it is the key to understanding why some people continue to have problems with their teeth despite excellent dental care and nutrition. But we'll get to that later. First, let's take a look at the first invisible danger. The first hidden inflammation accelerator is insulin resistance, a chronically elevated insulin level in the body. What does that have to do with your teeth? Well, more than you might think. Insulin is a hormone that regulates blood sugar levels. However, when it is too high, it promotes inflammation by increasing the release of inflammatory messengers such as TNF-alpha or interleukin-6, and thus also leads to tooth loss. When we regularly consume too many rapidly available carbohydrates, such as white flour products, sweets, or even hidden sugars in processed foods, but also simple staple foods like potatoes, pasta, or rice, our body has to produce more and more insulin to lower blood sugar. Over time, however, our cells become less sensitive to this insulin. They develop what is known as resistance. The body responds by releasing even more insulin, and this is exactly where the problem lies for your overall health as well as your dental health. And I want to give you a picture to really help you internalize this. Imagine you are looking down at a car driving on a road. The car is moving within a corridor. In this case, that's the lane. And as long as the car doesn't leave this lane, everything really seems to be fine. So, and this corridor, now translated to blood sugar levels, is basically the normal blood sugar level you have when fasting, meaning when you haven't eaten anything. So that's between 70 and 100 milligrams per deciliter. Yes, that's where it should be. But what you can't see from the outside, in the case of the car, is how much the driver has to struggle to stay in the lane and not drive into the ditch. Yes, just imagine he has to constantly steer against it because the car keeps pulling to the right. That means he has to keep making an effort the whole time so that the car stays in its lane. And the driver, in terms of your body, is your pancreas, which produces insulin to regulate your blood sugar level. So, ideally, it should hardly require any effort to drive straight ahead. Yes, that would be the case if fasting insulin is in the range of 1 to 5 microunits per milliliter. Microunits per milliliter is the unit used to measure fasting insulin. And the range found in nature is actually only between 1 and 2. But for normal people living in civilization, that's almost impossible to achieve. Yes, but you should aim for values below 5. So if fasting insulin rises and is between 5 and 20 microunits, then it's simply very exhausting for the pancreas because it has to produce much more insulin. And to stick with the car analogy, the driver now has to steer with much more force to keep the car on track. Yes, and from the outside, everything still looks completely normal. Yes, if you look at the car from above, it's driving straight ahead. You don't see at all, let's say, that the driver is already sweating. So, and only when insulin levels are beyond 20 to 25 microunits per milliliter does the blood sugar level eventually get out of control. Yes, that means the car basically goes off the road. And only now does the doctor realize that something is wrong and gives you medication, in the end even more insulin, which does lower your blood sugar level again, but at the same time further intensifies the inflammation in your body. So that means a persistently elevated insulin level acts like an accelerant for inflammation, and not just in the body but also in the gums. And current studies show very clearly that people with insulin resistance have up to a 3-fold increased risk of periodontitis and tooth loss. And among our patients, diabetics are also the ones with the most problems with periodontitis. So the tricky thing about this elevated fasting insulin, is that most people affected don't notice it for years. Yes, insulin resistance develops gradually over many years before it eventually leads to diabetes, and this period can easily last 20 years. Yes, but during this time you have already suffered significant damage to your periodontal apparatus, so to speak. And now you might be wondering why no one has ever measured your fasting insulin. The answer is quite simple. There just isn't a pill for it. Yes, anything for which there is some kind of pill that gets measured, whether it's your blood sugar, your blood pressure, or your cholesterol. Yes, but lowering insulin would require a change in your own behavior. And that's something no one can do for you. You can't just take a pill for that, and that's why it's simply not measured. And what's especially problematic, yes, insulin resistance not only increases inflammation, it also impairs the tissue's ability to heal. That means that even with good dental treatment, healing can be delayed if this factor isn't taken into account. In our practice, we often see patients who, despite regular professional dental cleanings and good oral hygiene at home, still struggle repeatedly with gum inflammation. And often, upon closer examination, it turns out that insulin resistance is present, even when the classic blood sugar values are still within the normal range. So you might now be wondering whether you yourself could be affected by insulin resistance. Some signs could be cravings for sweets, fatigue after meals, difficulty losing weight despite dieting, or an increased waist circumference even at a normal weight. I would be happy if you shared your thoughts about this in the comments. Have you ever thought about the connection between your diet and your dental health? Or have you perhaps even had experiences with dietary changes that have improved your dental health? Let's move on to the second invisible inflammation trap, arachidonic acid and the unfavorable ratio of omega-6 to omega-3 fatty acids. Arachidonic acid is a polyunsaturated fatty acid that serves as a precursor for inflammatory mediators in our body. Simply put, the more arachidonic acid you have, the greater the potential for inflammation. So many people now think that this is only a problem for meat eaters, since arachidonic acid is mainly found in animal products. But that's only half the truth, because vegetarians and especially vegans can also have high levels of pro-inflammatory substances in their bodies. The reason lies in the ratio of omega-6 to omega-3 fatty acids. In our modern diet, we often consume 15 to 20 times more omega-6 than omega-3. From an evolutionary perspective, however, a ratio of 2 to 1 would be optimal. And the problem is that plant-based linoleic acid is also an omega-6 fatty acid, which is found in many vegetable oils, such as sunflower oil, corn oil, or processed foods, and is often converted in the body into arachidonic acid. And especially vegans often consume a lot of sunflower oil because it's cheap and is naturally added to many vegan products. And the conversion process into arachidonic acid is further intensified by the lack of omega-3 fatty acids, because they compete for the same enzymes. That means the less omega-3 is present, the more linoleic acid the body can convert into arachidonic acid. And to make matters worse, this process is even further intensified by insulin resistance. So, for your dental health, this means that even if you avoid meat, you can still have a pro-inflammatory metabolism due to an unfavorable fatty acid ratio, which promotes periodontitis. The good news, this ratio can be relatively easily influenced by changing your diet. After just a few weeks, the body's tendency toward inflammation can measurably decrease, and with it, the susceptibility to gum inflammation. By the way, a very popular omega-3 supplement is Norsen algae oil with EPA. I always link it below in the video description. In my opinion, it's the best you can currently buy on the market. It's a vegan algae oil, so it's not derived from fish. And EPA is additionally added to it, so you also get this anti-inflammatory effect, and with the discount code Dittmann15, you even get 15% off your first order. Let me share an example from our practice. Mr. M, 52 years old, came to us with advanced periodontitis, even though he followed a vegetarian diet and paid attention to his health. He was confused as to why his dental health kept deteriorating despite good care. And when we analyzed his diet, we found that he consumed large amounts of processed vegetarian products every day, which were rich in omega-6 fatty acids. In addition, he mainly used sunflower oil to prepare his meals. We recommended that he switch to olive oil, eat more foods rich in omega-3s, such as flaxseed, walnuts, and of course sea fish, and reduce processed foods. Additionally, we supported him with a conventional periodontitis therapy. and after just 3 months there was a significant improvement in the condition of his gums. The bleeding points had decreased by more than 60%, and for the first time in years, he had not developed any new gum pockets. His comment at the follow-up appointment, "I never would have thought that my healthy vegetarian diet could actually contribute to my dental problems." Now let's move on to the third, and perhaps most surprising source of inflammation, leaky gut, which is a disrupted intestinal barrier. This syndrome is completely unknown to many patients, yet it is a common reason why teeth can be lost despite good nutrition. With leaky gut, the intestinal lining is more permeable than normal. The tight junctions, which are the close connections between the intestinal cells, then no longer function properly, and as a result, bacterial components, food particles, and toxins, that is, harmful substances, which should normally remain in the gut, enter the bloodstream. So the immune system recognizes these substances as foreign and responds with a systemic inflammatory reaction. And this chronic, low-grade inflammation affects the entire body and of course also the periodontium again. But there is another, often overlooked aspect of leaky gut, namely the absorption of nutrients is impaired. Yes, that means even if you take in all the important vitamins and minerals, they may not actually reach where they are needed because they simply aren't absorbed. For your dental health, this means you can eat optimally and take the best supplements. If your gut doesn't properly absorb the nutrients, then your teeth and gums simply won't benefit from them. In our practice in Potsdam, we have often found indications of leaky gut syndrome in patients with therapy-resistant gum inflammation, and typical signs, in addition to dental problems, also include food intolerances, skin issues, chronic fatigue, and concentration difficulties. The good news, this inflammation trap can also be treated. With targeted gut rehabilitation, rebuilding a healthy gut flora, and avoiding foods that weaken the intestinal barrier, the situation can be significantly improved. Let's summarize what we've learned about the 3 invisible inflammation traps. First, insulin resistance can act as a silent accelerator of inflammation and undermine dental health long before you are diagnosed with diabetes. Second, an unfavorable ratio of omega-6 to omega-3 fatty acids creates a pro-inflammatory environment in the body, regardless of whether you eat meat or not. Third, leaky gut syndrome can lead to inflammation throughout the body while also disrupting nutrient absorption. A double blow to your dental health. All 3 factors have in common that they often go unnoticed and can cause damage over a long period of time. The good news is, once they are identified, they can be specifically treated. Now, as promised, I would like to present to you my 3-step strategy to combat these invisible inflammation traps and secure your dental health in the long term. Step 1. Have your inflammation levels checked. This includes not only the standard blood values, but also more specific markers such as the long-term blood sugar value, HbA1c, fasting insulin level, omega-3 index, inflammation markers like high-sensitivity CRP or interleukin-6. Talk to your general practitioner or a doctor specialized in molecular medicine about these tests. Yes, and if you're willing to make the trip to Potsdam, you're of course welcome to have a checkup with my wife as well. She is an internist and specializes in these topics. I can gladly put the link in the description as well, but I warn you, it's not just a blood test you'll get there. You'll receive a complete checkup, which of course includes an ultrasound of your abdominal organs and your heart, and you might also have to do a stress ECG. You'll learn things about yourself there that you might not even want to know. So step 2, change your diet to combat insulin resistance and optimize your fatty acid ratio. Specifically, this means reduce rapidly available carbohydrates, replace omega-6 rich oils like sunflower or corn oil with olive oil, and increase your intake of omega-3 fatty acids through flaxseed, walnuts, or fatty sea fish such as salmon or mackerel, or supplement specifically with a high-quality omega-3 oil. This also has the advantage that, unlike sea fish, it contains virtually no heavy metals. So step 3, support your gut health. This includes avoiding foods that can weaken your personal gut barrier. These are often wheat, dairy products, or sugar, as well as building a healthy gut flora through fermented foods and, if necessary, probiotic supplements. These 3 steps can make an enormous difference to your dental health, even if conventional treatments have not brought the desired results so far. Today you learned that tooth loss is not just a matter of oral hygiene or dental care. Even with the best care and a healthy diet, invisible inflammatory processes in the body can undermine your dental health. And the 3 main factors, insulin resistance, an unfavorable fatty acid ratio, and leaky gut syndrome, often operate unnoticed, but with the right measures, they can be identified and treated. And with this knowledge, you are now able to understand and influence your dental health on a deeper level. For a beautiful smile for a lifetime, Feel free to share this video with friends and family members who are struggling with their dental health, perhaps without realizing that the cause could be hidden inflammatory processes. And if you enjoyed this video and want to learn more about scientifically based dentistry, then of course feel free to subscribe to this channel as well. It costs nothing, but it could change your life. And activate the bell so you don't miss any more videos. Feel free to leave a comment with your experiences or questions. I am happy to answer them personally. Thank you very much for your attention. See you in the next video. Until then, all the best. Yours, Dr. Reinhard Dittmann.